Now a very important reflex, very important reflex, your CNS ischemic response. This response, it is called as last ditch stand. It is also called as your emergency control mechanism. Why the term last ditch stand is written over here? Because this reflex, it is stimulated when BP falls below 40 to 60 mmHg. Body के सारे defense mechanisms fail हो जाएंगे, but this will exist to save the patient. Okay, that's why the name last ditch stand or emergency control mechanism. It is given to CNS ischemic response, and this is the mechanism. Once the blood pressure falls below 40 to 50 mmHg, there will be reduction in the blood flow to the vasomotor center. So reduction in blood flow, that will cause ischemia in the brain, cerebral ischemia. Ischemia होगा तो क्या होगा? There will be accumulation of carbon dioxide and lactic acid near the vasomotor center. These two substances, once these are accumulated near the VMC, they will strongly excite your vasomotor center. And once there is strong excitation of vasomotor center, strong sympathetic stimulation will be there, and there will be restoration of blood flow and normalization of blood pressure. Okay, that is the mechanism of your CNS ischemic response, and that is the reason why it is called as last ditch stand. Now here lies the clinical importance. Just see. Cushing reflex. Now this reflex, it is mainly seen in the persons having increased intracranial tension, maybe in the person suffering from cranial tumors. So what will happen in this condition? Whenever there is increase in the intracranial tension, there will be reduction in the blood supply of VMC. There will be strong stimulation of vasomotor center. यहाँ तक क्या था? There was CNS ischemic response, and we are discussing about Cushing reflex. उसका rule आता है. Once the VMC will be strongly stimulated, blood pressure will be increased, blood flow will be restored. Increase in the blood pressure, it will cause reflex stimulation of baroreceptors. The term reflex is used here. Why reflex? Reflex क्यों use करेंगे? Because directly नहीं हो रहा है कुछ भी. Indirectly there is stimulation of baroreceptors. Okay, indirectly कैसे? Because there is rise in intracranial tension, that's why there is strong stimulation of VMC, and here comes CNS ischemic response. That's why the term reflex is used. Reflex baroreceptor stimulation, it will cause reflex bradycardia. अब इसको explain करने की जरूरत नहीं होनी चाहिए. There is no need to explain this mechanism, because we have explained this mechanism several times, how stimulation of baroreceptors, it causes bradycardia. Again I repeat for you. Stimulation of baroreceptors because of rise in blood pressure stimulates nucleus of tractus solitarius. There is release of glutamate that will stimulate your caudoventrolateral medulla or the depressor area. From depressor area, there is release of inhibitory neurotransmitter, your GABA. GABA will inhibit the activity of vasomotor center, or your RVLM, inhibition of sympathetic stimulation, that will lead to reflex bradycardia. So again, there is significance of this reflex in patients having head injury and in case of CNS tumors. Now about the chemoreceptor reflex. Chemoreceptors, name of chemoreceptors, carotid body and aortic body. Okay. So these are carotid body. Don't get confused between carotid sinus baroreceptors and aortic arc baroreceptors. Where the term body is used, we are talking about chemoreceptors. Where the term baroreceptor is used, we had already talked about baroreceptors. So chemoreceptor reflex, unlike baroreceptors, it is a very important point to memorize. Chemoreceptors, they will stimulate VMC. But what the baroreceptors were doing, once the baroreceptors were stimulated, they were inhibiting your vasomotor center. That is the difference between chemoreceptors and baroreceptors here in the stimulation of, in the regulation of blood pressure. They will directly stimulate venous. So normally these chemoreceptors are not stimulated, but these are stimulated if the BP falls below 60 mm of Hg. What was happening in case of baroreceptors? Baroreceptors, they were not stimulated when the BP was less than 60. Chemoreceptors are getting stimulated. So these are of two types, peripheral, I had already told you, carotid body, aortic body. These are primarily activated by hypoxia, followed by hypercapnia and acidosis. Central and medullary chemoreceptors primarily activated by hypercapnia and acidosis, but depressed by hypoxia. Here is the mechanism of stimulation of these baroreceptors. Fall in the blood pressure decreases blood supply to chemoreceptors. There is occurrence of hypoxia, hypercapnia, strong stimulation of PMC, and there is normalization of blood pressure by increase in heart rate, increase in cardiac output, and increase in peripheral vascular resistance. So this is the mechanism of chemoreceptor stimulation. So till now we had discussed about the short-term regulation of blood pressure, where in detail we had talked about baroreceptors, then about your CNS ischemic response, and after that ultimately we had talked about your chemoreceptor reflex also.